My name is Saleyha Ahsan and I'm an emergency medicine doctor. I'm also the parliamentary candidate for the Liberal Democrats in Milton Keynes South. Now the reason why I've taken the leap and I'm going to do this and I'm going to go for it is because I am really worried, really concerned about the future of the NHS. I have seen the impact of Conservative government on the NHS, on my colleagues, on my patients, on the infrastructure. What have we seen under a Tory government? We have seen the end of the nurses' bursary that helped so many new nurses come to work for us in the NHS, and I've seen the direct impact of that over this time frame. Many nurses haven't been able to afford to come and do the job that they have wanted to do. It has made their ability to study, to train, to become the nurses of the future incredibly difficult. We have seen the impact of Brexit already amongst colleagues. We haven't even got Brexit and we have hemorrhaged staff. I have seen at close level, on the shop floor, staff, colleagues, doctors, nurses making crucial decisions about whether they can stay and work here in the UK, working for us. Many have left. That's not any rumour, that's not me making a mountain out of a molehill, that's fact and reality. And we haven't even got to Brexit yet. And personally, I have felt so ashamed that that's how we have thanked these extremely hard-working colleagues that have left their homes and their countries to come and work here with us, caring in a dedicated, passionate way for us when we're unwell. I've also seen the impact at personal level. I've seen poor care even to my family as a doctor who couldn't even rally support to get appropriate healthcare for my own members of my family. And if I've witnessed that at my level, goodness knows what's going on in the wider public. But actually, I do know it's poor. This is not good enough. We can do better. If you're sick, if a loved one is sick, if they're elderly and they're at home, and you've just been discharged from hospital, you don't want to have to then run the gauntlet, the really complex gauntlet of accessing health and social care in the community. You need something that's going to be full of empathy, support, kind and practical. None of that exists at the moment. I know, because I've been going through it with my own parents, it is far from being user-friendly. And when you're in that position, either as a loved one or as a patient yourself, you want a system that's going to be working well for you and that is there for you. You don't want to have to be fighting battles for the basics, and that's what we have been seeing with this Conservative government. The reason why I'm so passionate about the health and social care policy of the Liberal Democrats is because they see this as one unified issue. It's joint up, it's together. It's not two separate bits. They have joint up thinking, it's 360 degrees care for the patient at a time of need. That's why I'm doing this. At the moment, under the Conservative governments, that doesn't exist. And if they continue to have their way, I absolutely am really afraid for the future. But you know what? There is hope. And that's why, after 9 years of me being angry and upset and worried and concerned, I'm doing this. There is something you can do. You can vote for the Liberal Democrats. I am standing as a parliamentary candidate for the Liberal Democrats because I believe absolutely in their policy and their approach to health and social care. I believe in the joint up approach that they are going to bring forward to health and social care as one package, and that's what we need. I believe that together we can put the brakes on Brexit. I think that that will have an absolute positive impact on the NHS. It might not fix it overnight, but we will be moving in the right direction. So, I've done it, I've taken the leap. If you want to do the same, come and join me.